And we'll get started. Thank you so much for joining us today, in my case in Calgary, on this very snowy day. It's been quite a November. Welcome to our third and final session of the series, Co-Designing the Active City, Public Policies and Development Projects that Put Health Equity at the Forefront. So our mission today is to highlight 3 inspiring Canadian public policies that put health at the forefront and present 3 case studies of projects in the built environment that came from them. My name is Celia Lee. I'm Program Director at Active Neighbourhoods Canada in Alberta at Sustainable Calgary. And I'm also the National Policy Coordinator. I've been working alongside of policy for about 10 years.
Huh, so what? Oh.
Hello. Sorry about that. And thank you everybody for joining and for putting yourselves on mute. I'm Celia Lee. I'm also the National Policy Coordinator for Active Neighbourhoods Canada, and I've been working alongside of policy for about 10 years. So typically developing the case for policy change and collaboratively developing strategy to see that change come to fruition. The Active Neighbourhoods Canada network is a partnership between 3 organizations, the Montreal Urban Ecology Centre, which is our founding member, Sustainable Calgary, which I'm a part of, and the Centre for Active Transportation. Together, we've worked for about 6 years, developing, piloting, and sharing approaches to co-design for active, green, and healthy neighbourhoods. We work with communities to build neighborhoods that support walking, cycling, and other means of active transportation, and that's by providing safe and welcoming urban design. So our approach takes into account health, equity, and the built environment, and we call our approach participatory urban planning. That's our website, participatoryplanning.ca. So in today's session, we will come back very briefly on the last 2 webinars. This one builds on those 2. We'll discuss what is a healthy public policy and how to develop it. And then we'll look at 3 great public policies in Canada and 3 case studies of changes to the built environment that emerged from those policy changes. If you have any questions over the course of this, please enter them into your chat. I'll answer them at the end of this session. So at around 1:45, I'll stop giving the presentation and reserve 15 minutes for your questions. So from now on, you're most welcome to ask questions through the chat window. The webinar is being recorded and it'll be archived on our website right after the broadcast. If you want to refer to it later, again, that's at participatoryplanning.ca. So we'll start by going back to a few key concepts from webinars 2 and 3. Our series builds on the work of Dr. Theresa Tam, Chief Public Health Officer of Canada, and her report, Designing Healthy Lifestyles. In this report, she suggests there is a link between the built environment and health, and the link is quite simple. And in fact, since that report, there's been more research coming out that links the built environment not just to healthy behaviors, but to healthy outcomes. So that's a pretty great step. What Theresa Tam says is that if we build our cities and communities right, we can make healthy choices the easiest choices for citizens. And that's really important because humans like to conserve energy. We typically do go for the easiest choice. How do we make a healthy place? We build healthy assets into it. Healthy assets can be something like a bike path or access to healthy food. A park could be something like a strong sense of community. Could be really great connectivity between the destinations you want to get to. So what do healthy communities look like? Again, we do have some backgrounders on this on our website in our toolkit. But we know that a healthy community, should promote efficient, accessible, and safe public and active transportation systems. A community should not only promote physical activity, it should make it attainable. And according to urbanist Jeff Speck, that means making infrastructure useful, safe, comfortable, and interesting. Humans are very curious creatures. A healthy community also has complete streets designed to be safe for everybody, for all ages, in any physical condition. Green spaces purify the air and provide shade. They also create great incentive for physical activity, and they promote better mental well-being. And finally, a healthy community looks like mixed-use development. So people will walk when it's the easy option, even if they're not that into walking. Mixed-use development encourages healthy transportation choices. If we bring together workplaces, schools, shops, essential services in the same neighborhood, it becomes obvious that walking or cycling is the most obvious choice rather than opting for your car. So in short, what we've demonstrated in the last webinars is that the way a community is built has an influence on the health of its residents. Past webinars have also given an overview of the participatory planning approach. And again, you can find more on that on our website. But what we've shown also is that participatory planning is a great way of uncovering previously unknown issues that experts in their own communities can tell us about. And crucially, what I've found is that the participatory planning process, almost the most important thing I've found in Calgary, is that it creates empathy among the various residents and users of the neighborhood. And so it kind of turns someone who maybe used to not care too much about the built environment because it doesn't affect them too much, it can actually turn them into an advocate for healthy built environments. So what is a healthy public policy? And maybe we should start with what is a policy in general. So adopting a policy marks the will to work towards long-term goals together. But then it gets more practical. So a policy defines guidelines to take into account, and it suggests a set of concrete actions to both current and future decision makers. Ideally, it transcends changes of government, so you have to work for that, and it directs future investment. So policy change is not to be underestimated. What is a healthy public policy? So this is, for us, geared to the development of healthy places, and it has clear focus on health and equity. So these policies aim to create social and physical environments that make healthy decisions easier and healthy lifestyles easier and more possible and attainable for all of us. Within the ANC partnership, we don't prioritize health in isolation. We want to work towards equity, ensure that people have access to opportunities for work, education, play, healthy food. We want to build communities that contribute to a healthy environment and a healthy economy. And what I love about working towards healthy places is that they have so many co-benefits. So healthy places are climate-friendly places. They are good for local business. They create opportunities for social interaction. They facilitate aging in place. And some of the documents we host online go through supporting statistics on these co-benefits. In this vein, we also align our work with the UN Sustainable Development Goals. So our initial focus at ANC was on health equity in particular. So obviously good health and well-being, which is the third goal of the sustainability goals. The healthy places we aim for in our co-design projects can improve mental health and well-being. They can reduce the number of deaths and illnesses related to sedentary lifestyles. These are currently the leading diseases in Canada. Reducing the number of deaths and injuries from road and traffic accidents, and reducing deaths and illnesses from pollution. ANC's actions also contribute to achieving goal number 11, which is to make cities and human settlements inclusive, safe, resilient, and sustainable. So, for example, the targets we contribute to prioritize creating transportation options for everyone, regardless of their abilities or income levels, paying particular attention to those in vulnerable situations, and providing access to green and public spaces, again, particularly for women and children, older persons, and persons with disabilities. We work towards these goals in our co-design projects and continue to work towards them in influencing policy. So why is all of this important in Canada? Well, recently Canada received an overall physical activity score of D+ among our children and youth. They spend too much time sitting. And actually this weekend I was listening to this CBC show called Because News, and I think they were serious when they said that Canadians scored really well on intention to exercise. Very Canadian to give marks for effort. We also have an aging population, and seniors and children are among those of us who may not be driving. In the case of seniors who may be cut off from driving. And research has shown that seniors fear this possibility, not because they love driving so much, but because in car-centric cities, this removes connection and freedom. This was new to me. We've also seen that our senior population, those over 65, are getting a D in physical activity, and this doesn't have to be the case. Why else is this work important in Canada? We know some places are better than other places. We have an equity issue when it comes to investing in healthy places. This is a map showing research we did within Active Neighbourhoods Canada, investigating whether there is a relationship between neighbourhood income and pedestrian collisions in Calgary, Toronto, and Montreal. We don't know why this is the case in Calgary, why that relationship exists, and it does exist. But in other cities in North America, we know this is related to lower investments in infrastructure in lower income neighborhoods and lower quality infrastructure. So we have work to do. Finally, this work is so important in Canada in the context of climate change. We need to take collective action to mitigate climate change and its effects. And the way we design and build cities is among the most effective ways we can do that. So how do we develop a healthy public policy? We think about it in 8 stages or 8 steps. And different people might get involved at different stages, and different stakeholders can take a lead in this work, whether it's the general public or associations or health professionals or decision makers. So the first step is just to identify the issue. We want a detailed understanding of the situation, and creating a short document summarizing the issue can be really helpful, a valuable communication tool with stakeholders. On our website, we do host a couple of backgrounders on things like urban form and health equity that could be useful at this stage. You also want to assess your readiness. So policy development requires appropriate timing and resources over an extended period of time. So you want to determine whether to proceed with policy development, and that's based on whether your community is ready, your organization, your potential partners. You want to define pretty clear objectives for the potential policy change and generate a list of policy options for decision makers to consider. And we recommend that these objectives be simple and in plain language. And that's so that, you know, anybody can be an advocate. These issues affect everybody, and everybody should be able to speak to them. You also want to identify potential influencers and allies, who's already talking about the issue and who shares a stake in your issue. Building support for your policy depends on the framing of your message. At this stage, you should work to reach key decision makers and influencers through an effective communication plan. And then writing. This is the stage where logistical and legal aspects of your policy take shape. You want to make sure the policy is clear, concise, and aligns with your policy change objectives. Then you want to review completed work, implement the policy, no big deal, and then a proper monitoring and evaluation of the policy. So when I've worked in policy development, at times in stages 6 and 7, I've taken more of a back seat. I would be involved in writing sort of the objectives and the evaluation plan, but at some point, if I was advocating for provincial policy, for example, that writing would sort of happen within the bureaucracy, and some of the implementation would happen within the bureaucracy. But the monitoring part is really important for stakeholders to stay involved in, and in a really good policy plan, the community would be invited to continue monitoring the effect of that policy. To that point, you want really measurable indicators of success, again, that can be understood by the general public. And again, because this is an issue that affects us all, we should all be able to understand it. We should all be able to understand what progress looks like, and we should be able to speak to it. So this is not for experts alone. So we presented kind of a linear process, but it's not necessarily linear and step by step, and you can always adjust. And for example, the idea of like assessing your readiness, you might want to come back to assessing your objectives. You can always come back to. So I'm going to present on policies implemented by provinces and cities in Canada towards creating healthy built environments. And for each policy presented, I'll show how beyond focusing on just health, they respond to each of the 3 dimensions of sustainable development. So we'll highlight one more than others in each case study. So for the first policy, we highlight the economic dimension of sustainable development before showing how it serves the other 2 dimensions. So the first example focuses on the 2018 City of Calgary budget, One Calgary. In budget consultations, we were actually involved, Sustainable Calgary, in advocating for a budget that showed support for the elements of a healthy built environment. And we weren't alone. We were joined by businesses and community organizations, coalitions of the 2, which was awesome to see, organizations representing people with disabilities by the Calgary Climate Hub. So this was a true representation of the various interests with a stake in creating connected, accessible, vibrant communities. And one of the objectives in the 4-year budget was to foster strategic growth in existing neighborhoods. So 100 million was allocated to various projects, including in several communities we've worked with, but we'll focus on a $5.5 million investment in active transportation infrastructure in Manchester. And this was done in large part to promote tourism and economic development. And with that 5.5 million, the city wants to develop a complete street on 42nd Avenue. There are precedents showing the economic benefits of active transportation across Canada. And in Alberta, a report shows that this industry contributes to 315 million in the GDP and generates 195 million in income. And we can share that report with you in our bibliography. So can a policy encouraging active transportation have similar economic benefits in Manchester? We're about to find out. Manchester is a primarily industrial area with only about 1,000 residents. Most of them live in social housing. So most of the people in that area, visiting the area, are workers and clients of businesses. But the population there is projected to increase by about 150% by 2030. There's a lot of development going on in the area. It's also home to a booming microbrewery industry. And this is how the neighborhood came to get interest in active transportation. So the case study we're presenting is on the 42nd Avenue in Manchester. It's a street connecting the neighborhood to several other important parts of the city, including Stanley Park, 2 train stations, several businesses. 42nd Avenue is located in the heart of an area called the Barley Belt. This is an area where the beer industry is booming, and 10 breweries have settled on a 7-kilometer cycle route since 2011. Due to new investments in active transportation, the Barley Belt expects economic growth in the upcoming years because it's become really popular as a cycling destination in sort of a place that doesn't really invite cycling, to be honest, but it's really booming in that way. So funds are provided to this area to support the industry. Sustainable Calgary is also working in Manchester to ensure equity in future development and with the incoming funds for current residents. But we're going to start by talking about why this area is getting attention from an economic development perspective. So current members of the Barley Belt are so interested in active transportation, they've even created a map to help users find their way around and warn them of dangerous intersections, including at different times of day, as you can see here. And users of the road have come up with sort of a diagnosis of the street, showing that safety and comfort is quite poor, that sidewalks are damaged and sloped, and that the avenue doesn't really help create great connectivity to key destinations in the area. So the city's come up with a number of propositions, and they'll be moving forward with one of those shortly. So the implementation of this type of infrastructure will have an impact on new businesses. It'll impact signage around the Barley Belt, There'll be bike racks installed and other equipment. So this will make the Barley Belt much more accessible and connected, more attractive. It'll likely attract more visitors. It'll improve the visibility of the beer industry and of the local economy. So what other impacts will it have? Well, first, beyond promoting physical activity through cycling and walking, we hope this will benefit the population that has been growing there since 2011, or since 2009, sorry. Growth there has been 118% compared to the rest of Calgary at 12%. As I said, housing in Manchester is almost completely social housing. It has among the highest rates of people with disability and houses many new Canadians. So we're working in Manchester to ensure that funding to the area serves the needs of local residents and ideally ties them to new economic opportunities in their own neighborhood, that it improves safety and comfort and connection to local amenities and transportation options. And then from an environmental point of view, a complete streets approach will reduce, we hope, the modal share of vehicles. And when it comes to the Barley Belt, that might mean taxis and Ubers, just because of the drinking aspect of it. Ultimately, it'll lead to reduced GHG emissions, we hope, greenhouse gas emissions. If you want further information, we do have a blog on this issue. We also have a section on Manchester under our work, and by December, we'll have some more design work up there from our design workshop. So let's continue with the second dimension and highlight the environment through Quebec's sustainable mobility policy. The policy was put in place by the Quebec government over a 5-year horizon, and one of its goals is to reduce fuel consumption and greenhouse gas emissions. There's an investment of, the investment that interests us the most is the 61 million contributed to active transportation. In Quebec, for a distance of less than 5 kilometers, more than 800,000 Quebecers use a private car to get to work. So for short distances, people are still driving. And this policy recognizes that they could be taking other means of transportation. This is important given that in Canada, 2/3 of greenhouse gas emissions come from transportation. We can see that this policy assigns a lot of importance on tackling climate change. If we look at some of its targets, a 20% reduction of solo car trips throughout Quebec, 40% reduction of fuel consumption in the transportation sector below the 2013 level, 37.5% reduction of greenhouse gas emissions from 1990. In large part, the government wants to achieve these targets partly by continuing towards electrification of transportation, but also by moving towards a complete streets approach. So the case study we'll look at is in Saguenay in Quebec, on a pathway in Saguenay. And this project was begun in 2017. So it actually doesn't stem from the sustainable mobility policy, but it actually helped inspire it. It has been cited as an example. So basically, the Traverse du Coteau is an active transportation pathway located in downtown Saguenay, which has 146,000 residents, and it's an old Canadian National Railway that used to run through the center. Now it gives access to a lot of destinations in the city. Active Neighbourhoods Canada got involved through the Montreal Urban Ecology Centre. Before they got involved, this pathway was considered dangerous for pedestrians in some ways. It was interrupted by dangerous intersections. It lacked lighting. There wasn't much snow removal, and so its use was limited at the nighttime and in winter. But citizens got together to share what they wanted to see for this park, and that made it possible to redevelop the park and enhance active mobility by adding things like urban furniture, such as benches made by a local artist, garbage bins, bike racks. There was a mandate to remove snow or press down the snow to make it safer for pedestrians, and lighting was installed. We don't have the quantitative data to calculate a reduction in greenhouse gas emissions, but we do absolutely know that use of this pathway has increased, and that's because of easier access and the time saving by the shortcuts it provided, and making it more comfortable to use. Again, here's how it responded to two other dimensions of sustainable development. So it serves the economic dimension. It helps reduce the costs of congestion, which, as you can see in some of our resources online, are pretty substantial. And it contributes to the local economy by encouraging the implementation of complete streets in municipalities during construction projects and infrastructure reparation. So yeah, 1.8 billion to 2.5 billion are the congestion costs each year in Montreal. So that's one pretty huge economic benefit. We also know that cyclists are more likely to contribute to the economy than car drivers, to the local economy. They're more likely to purchase more over time. From a social point of view, by implementing complete streets, it offers more mobility options to more people. And it aims to reduce, it contributes to a Vision Zero approach. So the third policy we'll look at is Bike BC. This was established over a 4-year horizon, and it helps municipalities of all sizes promote active lifestyles and sustainable transportation. The program funds projects that promote active transportation, specifically to go to work, to school, or to run errands. So it's not aimed at tourism, although it could benefit tourism, or it could recreation, that is. A $20 million budget is allocated for projects in 2018 to 2019 that promote walking and cycling and offer an alternative to the private vehicle. The reason we chose to present you this program as one that responds to the social dimension is that it aims for social equity. And it does that by trying to offer more security and accessibility for vulnerable users. It prioritize projects that put a real emphasis on their safety. So for example, the program would prioritize projects such as bike lanes protected by physical barriers or multi-use lanes completely separated from the rest of traffic. It's also a program that promotes social equity. Part of their decision-making is also implementing projects specifically in Indigenous communities, recognizing that they can be marginalized and underserved when it comes to active transportation. And then by providing an alternative to multimodal transportation systems, it allows low-income families to opt for something other than the car, which can cost between $8,600 and $13,000 per year, which represents about 20% of a middle-class household's income, which is pretty substantial. We know that in British Columbia, on average, 1,600 cyclists and 2,500 pedestrians per year are injured due to vehicle collisions. So we're really happy to see Bike BC addressing this. What's interesting about this program is that it's been so successful in integrating BC's new active transportation strategy. So the BC government wants to build on the success of their program so communities can continue to build integrated and accessible active transportation systems that work for all users. So the case study we'll look at is based in Kelowna, BC, the Okanagan Rail Trail, which was a result of the Bike BC program. Kelowna is a municipality of 132,000 residents where 86% of all commuters take a personal vehicle to work. And we know that 120 to 150 accidents, 120 accidents involve cyclists and 150 accidents involve pedestrians in Kelowna. So it's really important to say, how can we take steps to reduce this? $777,000 were invested to convert a CN railway into a bike path, and the development project is still ongoing. Once fully completed, the trail will be 48.5 kilometers long and reach 212,000 residents along its route. So we started from a 24-kilometer railway between Coldstream and Kelowna that prevented them from connecting other than by highway. And in urban sections, there was a lack of infrastructure to make active transportation safe. So for example, near the university, there was actually no safe access to cross the highway to reach the campus. And so people often illegally used private roads to get there. So through this project, concrete measures were taken. So a multi-use lane separated from the road was built, allowing better connectivity and security for users. And this lane now also connects the university to key destinations in the city, such as the airport and downtown Kelowna. And if you're wondering whether you can actually bike to the airport, I have lovely photos of our the president of Sustainable Calgary cycling with his suitcase on his bike. Totally doable. The new lane also passes under the highway. So now a small change, an expensive change, but a small change, made it possible for university students to get safely to school, not using a car. Along the lakes, the railway has been removed to provide a flat, multi-use lane of 24 kilometers, making it easy for cyclists of all levels and ages to use it. And finally, like the other programs, this one meets the other two sustainability dimensions. So beyond promoting health, the Bike BC program contributes to economic growth and tourism in the targeted regions. So in Kelowna, the Okanagan Rail Trail is a signature project that will definitely help to define this as a tourist destination. I know that members of my family actually already go to Kelowna to cycle, so this will undoubtedly make it even better. It's expected that about 108,000 additional visitors will be attracted each year. So that also means new jobs. And then without mentioning it, the policy also contributes to reducing the costs associated with physical inactivity, which in BC, the annual cost linked with physical activity is $1 billion. And in Canada, it's $10 billion. And that's in the direct costs of inactivity, so like healthcare costs, and then the indirect costs in productivity. On the environmental perspective, the same issue is tackled. We're going to lower our greenhouse gas emissions. So I'm going to just take a moment to look over the questions in the inbox. One moment here. I am not the best at technology. One moment here. Go to meeting control panel. There we go. Chat. I'm not seeing any questions yet. What I can do is point you to some resources that we have on our website. So for example, we do have a toolkit aimed at policy, and there you can find one-pagers that start talking about some of the issues we want to address when we want to create policy that promotes healthy built environments. We have examples of like how we have one document called Let's Have a Conversation About Healthy Places. And so it just lays out some of the statistics of the benefits, the co-benefits of a healthy place. So benefits to health, but also benefits to economy, benefits to the environment. And And then it sort of suggests some questions that you can discuss as a community, but also that you can ask your representatives. So that for us has been a really great resource. We also created one for the province of Alberta, which is also up on participatoryplanning.ca. And in fact, we're getting together in a few weeks to see what we can do with the policy recommendations to take them further. So bringing together stakeholders and experts on the topic of policy within the various ministries that we want to affect. Yeah, check us out on participatoryplanning.ca. The other thing I'll say is that in just going off of what we know in from Sustainable Calgary's perspective, so in Manchester in October, we did do a design workshop to figure out what we can do to help residents so that when the area receives funding for active transportation, how can that funding also benefit its current residents? How can we make sure they're not ignored while we get really excited about the brewery industry? And how can this sort of economic activity benefit the people who are living there? Can they get involved with the industry itself? And so one interesting idea that had come up was to plant rows of hops plants within sort of the residential area to say like, hey, look, we're here and we're part of this neighborhood also, and we want to be part of the energy. So that's been really cool. I'm not seeing any further questions. What you can do is email us with your questions at any time, and we will respond to those in writing on our website. We also will have a bibliography of some of the references in this presentation that you're welcome to check out. I'll give it another couple of minutes, but then I'll call it a day. Okay, thank you everyone so much for coming, for listening. Do send us your questions later if you have any. Otherwise, have a lovely day. I hope this was helpful. And I really hope we can all keep building change together in Canada. Thank you so much. Have a really lovely afternoon.